All right. So first off, just because this is an official grant presentation, so I have to officially tell you a little bit about my program. I work for the Arc of Illinois, and the specific program I work for is called the Family to Family Health Information Center. And there's one of these in every state, and these are led by people who are family members and professionals. So I have both personal experience and professional experience navigating healthcare and disability systems. My program is designed particularly for children. That's what the grant is for, up to age 22. And that includes, of course, professionals as well as any family members with pretty much any disability, any chronic medical condition. There's a wide list there. And just to let you know, if you do have an older child, the ARC does have other programs that cover the entire lifespan. So you may not end up with me if you need help, but we do have people who can help regardless. And these are some of the things that I do, and we have these services also available for adults as well. The main thing that I do is individual consultations, either with families or with professionals, in whatever mode you want. That could be a phone call, an email, a Zoom chat, whatever works for you. These are completely free, covered by the grant, and you can just call me up and we'll make an appointment and we'll talk about whatever you need to talk about, whether you need help with services or programs, finding therapies. If you're having problems with anything, that is what we're here for. We also do some webinar trainings and conferences. Some of them are like this on a specific topic. Some of them are more general. Each month we offer a more general one. We do a lot of outreach visits, and we have an advocacy component where we work with other organizations, legislators, lawyers, all sorts of different types of people to try to advocate for people with disabilities. All right, so let's move on, and we're going to talk a little bit about some of the programs we have here in Illinois. I'm going to kind of do just a real overview of these. So once again, if you need more information on any of these, my contact information will be at the end. Feel free to reach out and we can consult on an individual basis. So we like to start with one of the basic programs, and that is SSI. So SSI is Supplemental Security Income, and this is a monthly payment that you can get for basic needs. So that is things like food and shelter, clothing. And once those basic needs are exhausted, you can use it for other things, but the intention is for those basic needs. This is a program for those who are very low income and have disabilities. For children under the age of 18, it is not actually that challenging to get in based on disability. It's a pretty wide range for children, but at age 18, that becomes a little more challenging because instead of looking at just your disability, they look at your ability to work. So that is a different metric. So it's a little more challenging for adults. If you do get in, it's $994 per month maximum. What we like to tell people is the income limits are higher than you think they are, and the asset limits are lower than you think they are. So you cannot have very many assets in this program, but you can have a moderately small number of income. So SSI is going to be a process through the Social Security Administration. So I have some contact information on there. And what we do tell people is that lately it's been really a long wait, over a year, and challenging to get SSI. That doesn't mean it's going to be like that for everyone. Sometimes we get lucky, but it can be a bit of a challenge. I also always like to talk just a little bit about Medicaid. And the reason I like to talk about Medicaid is because a lot of people don't realize that they may actually qualify for Medicaid. What I will tell you is my family started qualifying for Medicaid, well, just my daughter, when she was 3. And in the first year we qualified for Medicaid, we saved $20,000 in medical expenses that we had to previously pay with our private insurance. So Medicaid can be really helpful for children with disabilities. And I have here both the income limits for kids on the left and adults in the middle. And what I will tell you is, particularly for kids under the age of 19, if your family of four is making $102,000 or less, that's quite a bit. You can still qualify for Medicaid. So that's what I like to make sure we get as many people into Medicaid, even if they have private insurance, just because it can really, really help with the financial picture for a lot of people. So for kids, again, under age 19, those income limits are high. There are no asset limits, there are no immigration requirements, and you can have other insurance. For adults, the income limits are lower, so that is something that we do have to deal with adults. Most adults with disabilities can qualify through one of these various programs, and there's one on here I don't have listed for adults who work, which goes up even a little higher in terms of assets and income limits. We recommend for applying for Medicaid and SNAP to apply online if at all possible. If you call that 1-800 number, you will be on hold for 4 hours. I do not recommend it. You can go to your local office. I had a mom call me today saying she had a great experience with no waiting at her local office, so that is a good option. Paper applications are also still a great option. Sometimes that's just a lot easier than trying to figure out and navigate a whole online system. So we talk about Medicaid with people with disabilities, and that leads us to Medicaid waivers. So Medicaid waivers, if you're not familiar, these are programs that provide both Medicaid and extra disability services. These are paid half by the federal government and half by the state. And we'll talk about some of the ones in Illinois, so I'm not going to go into all these example extra services I have listed here, but there are a wide range of disability services that can be offered. Every single one of these is different. Everyone in Illinois is different. Everyone in all the other states, if you look at Indiana or Wisconsin or Missouri, those are totally different. So every program is going to be different, and they may be different. They may serve different age groups, different disability populations, and they may, some of them may have waiting lists, some of them may not. So we'll talk about the ones we have here in Illinois. We have 9 of these waivers here in Illinois, and they are the fundamental way that the vast majority of people in Illinois get any of their disability services, basically all of their disability services. So I've grouped them here in 3 categories. We're not going to talk about all of them today, just because some of them are not that relevant. We do have children-only waivers. You'll note that some of these have some stars. We'll talk about why in a few minutes. That includes 2 waivers for those with developmental disabilities and 1 for those who are medically fragile. We have 3 DRS Home Services Program waivers that are for people with more severe disabilities. And then we have 3 adult-only waivers. And we'll just be talking about the adults with DD from those today. The other 2 are primarily for people who are elderly. So just a brief overview of the medically fragile technology dependent waiver. This is a waiver that provides home nursing care, and it's for people who have medical technology. So if you do not have medical technology, this program is not going to be available to you. It also requires that you enter before the age of 21. If you enter before the age of 21, you can stay forever. As long as you medically qualify, but you have to enter before the age of 21. So that's an important date to know if you are someone who maybe could qualify for this program. The nice things about this program is it has no waiting list. We love programs without waiting lists. It does not count parent income, another thing we love. We don't have to worry about household income or household assets. And it, as with any waiver, it'll provide full Medicaid coverage plus extra services. In this case, those extra services are over there on the right. So those are things like respite, home and vehicle modifications, a whole lot of new adaptive and assistive tech, everything from adaptive bikes to computer software to generators to all sorts of things. as well as nurse and family training. If you are interested in this waiver, the way to apply is through the Division of Specialized Care for Children, and I have their information there, including their phone number, and they do answer their phone number. You can also work with your hospital social worker, etc. If you are unsure about whether your child might qualify, give me a call. I'm real good at helping people figure that out. I have a lot of experience with this program. Moving on to the next program, this is DRS, which is the Division of Rehabilitation Services, Home Services Program. This you may hear as the DRS waiver or the DOORS waiver. It's actually a set of 3 waivers. This is supposed to change. They've been saying for 3 years it's going to be 1 waiver, but here we are 3 years later, it's still 3 waivers. So that may happen next year, we'll see. But it doesn't really matter. Those 3 waivers are basically the same, and they are waivers for all ages. Again, here's a thing I like, no waiting list, but this one does count family income. So if you have an individual under the age of 18 for the full program, including Medicaid, you're going to have to qualify financially for Medicaid. So that's that $102,000 limit for a family of 4. There's also an asset limit for this waiver. That asset limit is really problematic for a lot of families because it counts a wide range of retirement accounts. And so for those under 18, that can be a problem. This is a great program for those who are kind of in that 18 to 21 age group because it has no waiting list. And at that point, at age 18, it will change to just counting the child's income and assets, which is usually minimal or none at age 18. And so that enables a lot of people in that 18 to 21 age group to get into this program. A nice thing about this is it's not diagnosis specific. So it's based on how much assistance you need with your skills of daily life. And they will score you on those skills. And if you score 29 points or higher, you are eligible for the program. And whatever that score is will also provide a certain amount of set funding that you will get based on your score. This program is hard for young children to qualify for. The older the child, so 12 plus, a lot easier, 18 plus, way easier. And that's just because they ask questions like, can you manage money? Can you clean your house? And a 3-year-old or a 5-year-old is not doing those things. So that's why this waiver often is much more easy to get into when you are a little bit older. As I mentioned, this is not based on diagnosis. So even though it's listed as a physical disability waiver, we have people with all types of disabilities who are in this waiver. That it can include autism, mental health, physical disabilities, health disabilities, etc. The main service you are going to get in this waiver is personal assistance. So help at home, someone helping you with your daily activities at home. That can be a parent or a relative who can be paid regardless of the age of the individual. So the parent can be paid for a child, the parent can be paid for an adult. So that is something that people really like about this program as well. This is just a quick look at the tool, how people are scored. And as you can see, hopefully you can see this isn't too small. There's basic questions. Do you need help with eating, bathing, grooming, dressing? And then more complicated ones, laundry, housework, etc. All right, so now we'll move on to the developmental disability waivers. And we'll first talk about the 2 children's ones. I like to call these waivers the kind of invisible waivers because they're very small and it's almost impossible to get into them. And these waivers on paper are for people who are 3 to 22 and they don't count parent income. And they're for anyone with an intellectual disability, developmental disability, autism, cerebral palsy, or epilepsy. But the problem with these waivers, the home-based version of these waivers, is that they have an extensive waiting list. And by extensive, I mean in the past 17 years, they've only pulled people off the waiting list twice. Otherwise, the only way to get into this program is to get a crisis spot. So this is a program that usually people can't get into until age 21, 22, or 23. It's unfortunate. That's just how it is. If you do happen to get into this program, there's a support waiver. That's the home-based version. There's a residential waiver. That's a small group version. These are for kids. We'll talk about the adult one in just a minute. Kids get a monthly funding amount, which is $2,088 this year, and most of them use that for personal support. There are some other services like home and vehicle modifications. If your loved one, you need them to be in a group home. That one does not have a waiting list, so you can get group home care for a child ages 3 to 22 without a waiting list if that is your choice. Most families do not opt to choose that particular option, but it is available. Now, there is an adult version of this waiver. It's almost identical. The main difference is you just get a little bit more money and some additional services. And this program starts at age 18. You might have noticed the last one ended at 22, so there is an overlap there to allow people to move from one to the next. This one has the same waiting list. We'll talk a little bit more about that in a minute. The good news about this one is there was a lawsuit, and the lawsuit mandates now, the agreement based on the lawsuit, that you get services within 5 years. And we're running actually more like 4 years right now. So the waiting list for adults after the age of 18 is a little bit shorter. It's not 22 years, it's 4 years right now. Same group of people are covered in this waiver. You get a little bit more money, assuming you finish school, so $31, $32 per month, and you can fund things like personal support, including having parents be paid, community day services, adult daycare, behavioral services, employment, home and vehicle modifications. And there's another option here for adults who want to live in a group home, which we call a SILA. We won't go into detail about that, but that is an option that a lot of people do choose, especially as their loved one gets older. So the way to get into both of those waivers is by getting onto what is called the PUNS lists. And PUNS is not a program. You may hear people say, I have PUNS funding or I am in PUNS. PUNS is just the name of the waiting list. So we try to make sure people understand that they're not actually getting a PUNS program. It's just the name of the waiting list. And it's for anyone who wants to be in one of these developmental disability waivers. You can get on this waiting list as early as applying at age 2.5 and getting on at age 3. The easiest way to qualify is based on intellectual disability, which is defined as an IQ less than 70. Otherwise, it's a little trickier, but not impossible for those who have a defined developmental disability or a condition like autism, cerebral palsy, or epilepsy. There's 2 categories for this. We always tell people to be in the seeking services category because I have never met someone who wasn't seeking services. There's a planning category as well, but we always say just get in that seeking services category. It is now a first on, first off waiting list. The only exception, the only way to bypass this waiting list is a crisis situation, and that has to be a pretty big crisis. As I mentioned, after the age of 18, you have that 5-year guarantee of being pulled. So we like to say the PUNS list kind of resets at age 18, where you're going to be in that group that will be pulled within 5 years. To get on that PUNS list, you're going to find your local independent service coordination agency. And you can either call or find that online. Finding it online is easiest. You're also welcome to call us and we can help you with that. So a lot of people say, which waiver should I pick? And this is really going to be dependent on your individual circumstances. Generally, if you have a lot of medical technology, we recommend that MFTD waiver. but a lot of people could be on both the developmental disability or DRS home services program waivers. So here we have a few ways of sorting that out. If you need services right now and don't want to wait, DRS Home Services program is your best option because there's no waiting list. You may also get more hours with that program. It depends on your individual circumstances. But if you want that community day program or you want that group home living, the only way to get those would be on the DD waiver. I'm going to breeze through these next few slides because these are basically a whole lot of charts. I really like charts. And these just compare all the waivers in different ways. And I'm just going to kind of breeze through these. This is just a comparison of those two adult programs, the adult DD waiver and the DRS home services program, or the DOORS waivers. So that's just a basic comparison of the two, one with a waiting list, one without. One requires diagnostic criteria, the other does not. So some interesting comparisons there. And this is just one by age group. So you know what age groups can qualify for which programs. So that's just something you can take a look at. I'm happy to share these slides out so you can look at them later on your own time. This is one for those of you who have a child under the age of 18. This is one that's going to tell you which programs are going to count your household income and assets and which are not. So as you can see, that home services program, they are going to count your family income, and there's also that asset limit. The other programs for children do not count those. And here's just a little bit on the waiting list. This data is a little bit old. This is from 2025. But as you can see, we have some programs with waiting lists and some programs without. Those waiting lists are quite long, as you can see in the waiting list info. It's not additive, though, because as I mentioned, the age groups do overlap. So there are 10,000 for the kids waiver and another 10,000 for the adults. About half of those actually overlap. All right, just a few more programs that I'd like to mention. If anyone has a child with behavioral health issues, mental health issues, emotional issues, we now refer everyone to one place, and that is Beacon. Beacon is our state's front door for children's behavioral health programs. All of them can be accessed through Beacon. So this is particularly for those who are 5 to 18. It does go up to 21, but 5 to 18 is the focus of this program. I always like to talk about special recreation just a little bit because kids with disabilities should still be having fun. And so we always like to refer people to special recreation. If you are in the city of Chicago, that is going to be the Park District here in Chicago, as well as a lot of private programs around the city. But in other places, you may have a special recreation cooperative. And at the bottom there, we have a link to SRANI, S-R-A-N-I, which has the list of all of the programs across the state. So these will range from sports to outings and classes, all sorts of great things. Everybody deserves to have fun. And our last, I think this is my last benefits slide, is just for those of you who are still in school. This is a question that comes up a lot. How do I get help? So these are just some resources for getting help if you're still in school. Family Matters is now serving the entire state and will help you one-on-one with your IEP and anything you need. They are wonderful. I highly recommend them. Equip for Equality, Illinois Guardianship and Advocacy Commission, and the Illinois State Board of Education also provide special education help. All right, and then our last section here is what happens when you get denied. So this happens a lot, and we'll go through different types of denials and how you'll handle those. So the first is, what if you apply for Medicaid or SNAP and they just say you don't qualify? What do you do? The first thing you're going to want to do is you're going to want to figure out why, and then you're going to want to appeal. You can appeal online or at an office, and we actually had an entire webinar on this last year. So I have a link there to our webinar the slides from that webinar as well as a recording that you can take a look at, and that will demonstrate every step of how to appeal. And we recommend both legal aid, that could be Chicago Legal Aid or another legal aid in the state, as well as Legal Counsel for Health Justice. They help our families all the time with these kinds of appeals. A lot of the time they're just procedural and somebody just checked the wrong box and we are able to get them fixed. So that's if they say you don't qualify at all. I also want to make sure people who are in Medicaid realize that they have what are called EPSDT rights. And that sounds like a crazy thing. Nobody's ever heard of EPSDT. And that's okay. You don't need to worry about the term. I just want you to know what your rights are. So this is for those under 21. Unfortunately, this only goes up to age 21. So EPSDT is like the package of services you get as a child through Medicaid. And what that rule says, this is a federal law, and what it says is that if you're under 21, you are entitled to any medically necessary treatments your doctor prescribes, whether they're part of Medicaid or not. If your doctor prescribes them and diagnoses you with something and says this is what you need, you are supposed to get it. That means there cannot be limits on therapies. There cannot be limits on prescriptions or supplies. Not only that, Medicaid is required to arrange your services and make sure you get them. So if you are having problems with getting your services through Medicaid, knowing these rights is really important. You can always contact me and I can help you to figure out ways to use these rights to get what you need through Medicaid. As I mentioned, unfortunately, this ends at age 21. And we do not have as robust laws and rules after age 21. If you are in a Medicaid managed care plan, so that'd be something like Blue Cross Community, Molina, Meridian, what am I missing? Aetna, County Care. So if you are in one of those and you are not getting what you need, there are two things you can do. The first thing you can do is file a grievance. A grievance is not an appeal. A grievance is a complaint. So if you're not getting a service you think you should be, that's a place for a grievance. If somebody is treating you unfairly, again, a place for a grievance. There is a form to fill out for each provider. They have their own, a slightly different process, but there's a document there that goes through all of those. Appeal, on the other hand, is if you've been denied a particular item or service or prescription. It could be a piece of medical equipment. It could be nursing care, any of those things. If you're denied that, then you're going to want to do an appeal. So first you are supposed to appeal through the MCO. I will tell you this never goes well, and this is something we're working on with families. It's very hard to appeal in that way. If you lose that appeal, which most people seem to do, you can then appeal through the state. And we do urge people to file those appeals right away because you can preserve what you're getting if you appeal right away within 10 days. And that appeal can be done online and a variety of other ways. And that is a link there that shows all the ways you can appeal. Now, if you are not in one of those plans, you're just going to do that appeal through the state. So as you can see there, the instructions for the appeal through the state are the exact same at the top there. If you are appealing a Medicaid waiver, there may be a different appeal system. And so you're going to have to talk to your coordinator to figure out the appeal steps there. You're also welcome to contact me. I'm pretty familiar with them for most of the programs. How about insurance denials? There are 5 steps you can take when you are denied by insurance. And usually, at least in my experience, I get things done by step 3 here. I've had to go to step 4 once. I've never had to go to step 5. So what you should think about is step 1 is always appeal your decision with a letter of medical necessity from your doctor. That's step 1, saying, I'm appealing this, you should have approved it, and here's why. If they say no, then you can do what's called a peer-to-peer. That is when your doctor talks to a doctor at the insurance company. And they talk doctor to doctor, and the doctor explains why your service or item should be approved. And that often works. If that doesn't work, you can ask for an appeal with an outside doctor. So that's somebody outside of the insurance company who will look at your file and say, what were they thinking? This should have been approved. And then hopefully you'll get approved then. And I have had success with that personally. I've had that work really well. If you still get denied at that point, you can go to the state's Department of Insurance or the state attorney general, and they can help you appeal as well. For there are a variety of different reasons why this may happen, and these get complicated, but they're actually really helpful over there at the Department of Insurance, and they'll walk you through it. If you still get denied after that, you can take legal action. That, of course, is a lot more complicated. I've never done it. I hope none of you ever have to do it, but it is an option available to you. And just a little bit more on those insurance denials. The vast majority of them are based on mistakes. And some of these I think are sort of intentional mistakes. So make sure you look at those insurance denials, question everything on them, double check your copays and co-insurance, double check how they were coded. A lot of the time it's just simple errors or things where they try to skirt laws and that kind of thing, and they are billing you for things they shouldn't be billing you for. Always start with a letter of medical necessity from your doctor. Also know state rules. There are state rules that say certain things must be covered in the state of Illinois. These include autism services. These include things like hearing aids. There's a bunch of different ones. So if you're familiar with that, you may be able to save some money. I actually used this myself recently. I had to pay some money for a mammogram, and I knew that that was not allowed. And so I was able to go to the insurance company and say, my state doesn't allow this. You cannot charge me. And they refunded my money. The most important thing you can do is to show them that they will save money in the long run if they pay for whatever it is you're getting. In other words, if you're going to save them money, they're going to be all over it and want to approve it. So that's the best way I get things approved, showing that it'll save money in the long term. What happens if you go through all these appeals and you still are getting nowhere? So I have a few options here. The first is try to see if you qualify for any other funding programs. And so that could be that secondary Medicaid I talked about at the beginning. That could be a program through DSCC or early intervention or a state-based grant. There are a lot of others. These are just some of the most common ones. You may also be able to get support from your city or town. I live in Chicago. Chicago offers a lot of extra services, actually, for people who don't get them through various insurance or Medicaid programs. So your city or town may offer alternatives. And there is, of course, always charity and grants. We recommend the database Support Now, which allows you to search for grants based on everything from age to condition to state. We also recommend organizations like Lions Club or Rotary that are local and often fund a lot of services. And the least favorite option is the GoFundMe, which is basically fundraising for your healthcare. Just be aware that that can have implications for Medicaid, SNAP, and other state benefits. So I have talked more than enough. So I'm going to stop here and I'll put